it has often been asked why treatment period for the ADAURA was 3 years in the first phase. We decided on this 3 years period because several manuscript has been shown that more than 90% of the cases that recur have a recurrent event within the 3 years. So looking at the disease-free survival curve for the ADAURA, we can, especially placebo curve, we can observe that it starts to the plateau around the 3 to 4 years post-operatively. We judged the results are similar to those reported in the past. So therefore, 3 or 4 years later, recurrent event the plateau, the few. Therefore, 3 years admission is the best for the ADAURA study. On the other hand, there is no scientific evidence that 2 years is a good duration of oral adjuvant therapy. Indeed, the ARENA trial showed a significant prolonged of the disease-free survival after 2 years alectinib. But I believe that we are talking about ALK-positive cases, not about EGFR-positive cases. I mean, the EGFR population is a little bit different between the ALK population. So EGFR is a mutation, but ALK is a transfusion, a little bit different. Based on the osimertinib adjuvant, considering that 66% of the patients were able to take osimertinib for 3 years, 3 years as planned, and there is a median exposure time of the 35.8 months, nearly 5 years. Although some patients is a dose reduction, 12% of the low dose reduction, and 77% with a dose interruption. But anyway, so safety. Also, most of the people can take 3 years. So that very safety. For the patient of the point of view, it seems unlikely that they would want to reduce the time to the 3 years to years, unless of course there were a financial problem. On the other hand, if the time comes when the additional information such as the ctDNA can be used to tell the patient that there are no longer a risk of the recurrence, I believe that some people will be able to stop after 2 years. This is my idea. So based on this idea, the 5 years, one point. Conversely, we often hear the idea that it may be better to add longer adjuvant therapy than the shortened it, based on the estimated trend to the increasing recurrence event after 3 years of the treatment based on the shape of the disease-free survival curve, like this. So based on this idea, a 5-year single-arm target trial is being conducted in the common and uncommon mutation-positive populations. Personally, I expected that the 5-year treatment period may not be necessary for all cases. Similar to shortened scenario I mentioned earlier, if the biomarker emerges that tell patients that they have a very low risk of the recurrence at the end of the 3-year courses treatment, I would use that to consider the need for longer treatment.